Hi, it's the Exceptional ND team here, Dr. Krista, Dr. Jody, and myself, Dr. Sonia. We're joined by an amazing and absolutely exceptional naturopathic doctor, Dr. Pam Thornton. Now I've known you for years. We've
Years.
crossed paths early on in my career, and you've influenced mine. I was just saying before we got on, you were part of my origin story in autism because one of my closest friends took over your practice, and that's how I learned how effective B12 injections could be for little ones. So thank you for that and for all you've
You're
done to
welcome.
improve our profession. I know you took on a new project there in 2020. Perfect time to
I
start a
did.
new clinic, but I think it sounds like a bit of a passion project. So I'd love to hear more about the womb, right? The
It
location
is.
that you
It is
have
the womb.
in
Yeah,
Woodstock.
I will share. So the womb in Woodstock. So the womb still, people think there should be giant legs outside our front door. It actually, it is an acronym that stands for the world of my baby, and it was.
Oh,
It's a franchise. So we are one of 6 womb locations around Ontario. The owners originally were a pair of doulas that started what was called the Halton Doula Group, and they
yeah.
quickly recognized the need for like integrative care. So I had practiced, I'm a 98 grad, so I had practiced a long time. As you guys know, I had worked in all sorts of different worlds, continuing my education. And then when this was put in front of me, started in 2019, we didn't know the world was going to go to hell and back then. I'm allowed to say that on
Oh,
this.
yeah.
Okay, good.
Because it did.
Because it did. And we were
Yeah.
trying to open a business. So they presented this to me as this opportunity to join this team. Originally, it was just a team of practitioners. I do a lot of referring. That's on my list to talk about today. So I was like, hey, yeah, hell yeah, let's bring this thing to a small community. Perhaps having it here would draw more practitioners because we didn't have an osteopath in the city at the time. We didn't have, and in the end, it has worked. We have 2 osteos that work with us now. So it's a beautiful center. It's a beautiful concept. So I now have 4 NDs. There's 4 of us in there. There are 2 chiros. We have massage therapy. We have pelvic health physiotherapy. We have osteopathy. We have lactation consultants. We have counselors. We have yoga teachers. We have this like doula group. So it's this really integrative care center, primarily focused on women's health, postpartum, and then I take it through the generations. I do a lot of menopause, perimenopause work, part of my draw to it. So it's been great. But what happened when I started there was there were 6 locations. When we were the 4th location, really. There are now 2 more. Guelph has the location now, and so does Grey Bruce, which is cool. That there's
Oh,
way up north. So they've drawn these professionals, but as you guys know, in our profession, we have this like diversity of NDs that are sort of over informed and underprepared. And so the standard of care just wasn't where I'll join this team, but you're going to have to bring up the standard of care. So I kind of quickly took on this role of director of care, naturopathic care for the wombs. So there are about 10 NDs, 10, 11 NDs, depending in all the locations. So I started working on a training program that was really designed to just not standardize naturopathic care, but to bring the bottom up, if that makes sense, to sort of make it such that if you had an experience with a womb ND, it was damn well going to be good. So
awesome.
that's the idea. So, and that's what I still do.
Oh my gosh, I love that. Yeah, we knew I think the original doulas who opened up in Halton, right?
Yeah.
Because we're Halton folks over here in Burlington. So it
Yeah.
was incredible. They've helped so many women.
Lori was actually my doula with Maddox.
That's
Nice.
awesome.
Look at how the world's crash, right? It's so
Yeah.
cool. It's
Well,
so cool.
I sat on a breastfeeding committee, I think, with her or the prenatal committee. I can't
The
remember the Halton
prenatal, prenatal
yeah.
for sure. I
Yeah.
sat on a committee with her. Yeah, for sure. Yeah.
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 It was awesome.
They're lovely women. And so they mostly sort of run the sort of franchising now, and we sort of
Smart.
independently run it. Yeah, smart, very smart.
Do you go location to location for training?
A little bit. Most of it's done on Zoom. Most of it's done on Zoom. And then what we've done since I did the original training, I'm still I have kind of 2 sets of training. So the first one was 6 2-hour blocks that we did by Zoom. And then the next one is designed once I get more of them with the prescribing. I still am sort of shocked by the number of NDs that don't have prescribing. I get it. I know it's hard, but they kind of got to do it, right? So once I get a few more prescribers, then I've got another block ready to go out of the gate. I just need them there. So in the interim, we've just done these sort of quarterly meetings, which I try to move around to the locations a little bit. And it's great to get their bodies together. The last one we talked about measuring fundal height, and the new grads aren't being taught how to touch bodies really. So we had 2 pregnant NDs luckily in a group, and we were like, hey, guess what, we're going to poke your babies for an hour. So it's nice to get a group together that have a common belief and understanding and just keep pushing. And then in between, so we do that quarterly, and then we run a Telegram channel similar to Exceptional ND that we can fire cases at and questions at and
Nice.
kind of help each other out.
That is awesome.
Yeah.
Would you,
And
yeah. Was this to say, would you train other NDs outside the womb? Like, are you
I
doing
would.
it? Are you doing it?
I haven't yet. And I would love to. I think it's, as I did this originally was like, I got to get these guys up to speed.
Yeah.
And then it went off beautifully. Like it was really a great course to teach. It was fun. They had like great questions. I think it did help a great deal. Of some of it just pure practice management, other stuff that was like tough cases. It was great. So, but then I was sort of like, I think this is being taught in other places. Like I'm sure someone else is doing this. So, but that doesn't mean there isn't a need, right?
Yeah.
and you touched on the importance of a few things here. Then we've talked to other naturopathic doctors, and you know, like we're all elders now, right? We're all over 20 years out, and the importance of getting your prescribing exam. I'd love to hear more of your thoughts on that because we believe the same.
Yeah.
Yeah, you know, I'm gonna sound really like pigheaded, but like I just don't think it's optional. Like, I'm sorry, I know it sucks. I did it too. It sucked. I did it with 3 little kids at home. It's awful, but I just don't think I don't know how it's like practicing with your hands behind your back, first of all, not having it.
Yeah.
But I also think that it's just not advancing our profession the way we should be
Yeah.
advancing our profession when we haven't done it. So I don't know the politics. Should we be integrating it into the CCNM program? I don't know, but I certainly my team gets a lot of pressure from me. That's like, you just gotta do it. I'm sorry.
I think the students can technically do it at the first part of 4th year. But I think it's such a big pill to swallow. I don't think there's a bit of reinforcement. So I don't
Right.
know. I don't know
think
how
there's
to change
also
it.
an issue
Yeah.
though with the space, right? Like
Right.
I know my student reps like have told me when they would go to try and register for it, because they'd only write twice a year, that it's always full, and like
Okay.
students, they don't prioritize students to get
Right.
spots, so they can't oftentimes write it just because of space, not necessarily because they don't want to.
Right. That makes sense.
So that's a
That
bit of
makes
a
sense.
no issue, and I'm not sure how we kind of help change that piece. But if you can't write the exam, then it also makes it a little bit harder for you to get motivated to study to do it.
Yeah. You're like, I'm all ready to go, but I didn't get a spot. Okay, then I'm all ready to go. Like it's exhausting to even think about it, much less
Well, and
prep
just
for it and get
stay
it ready.
ready.
Yeah,
Yeah, like
stay
just
ready.
stay
Yeah.
ready. You can't. There's a lot of stuff you have to shove in your brain for that and spit back out for that exam.
So maybe that's
Yeah,
something where we can reach out to the OND, right? Because the
I just,
Yeah.
OND
I
should.
just did it.
You just
Yeah.
texted just 1 second. Beep, beep, beep.
I
We
did.
have some really great new OND members, right? And
Yeah, it's awesome.
Jody did fantastic work on the OND, and I think they're really, the communication is better is what we're hearing, and they're making some forward progress.
Good.
Yeah, so maybe that's something we can bring to them to have a separate student exam.
Yeah.
Right, because
Yeah.
it's the college, but obviously, like we just talked to Dr. Tara Gignac, and you know, the college does what the government tells them they have to. It's all about patient safety, it has nothing to do with lobbying. And then for us as naturopathic doctors, as such a small profession, we need to go to the OND in Ontario and say these are the things that we need done, and we need to advocate for the students
Yeah.
because
They
they
can't
don't.
advocate for themselves.
Well,
They can't.
it's unfair to ask them to navigate when they don't know the history, right? It's
Right.
such a long history of these organizations, and
Right.
yeah.
And it's, when they're in that brain, I think when they're still in that brain, writing the exam would be so much easier for them than it certainly was for us. Like, I think I was almost 20 years out when I wrote it. Just like a little funny side story that I wrote that stupid exam, and I had written on a bubble. I've done this bubble, whatever the hell, multiple. I hadn't done one for so long. I left. I walked out of the room and I was like, I didn't put my name on it.
Oh my gosh.
Luckily, I walked back in and said to the woman, I think I didn't, she laughed. She's like, oh my God. She goes, well, look through. If there's 2 without a name, you're screwed, right? Like,
Oh,
luckily, I was the only idiot in the exam that managed to pass the exam, but not know to put my name on it. So, being fresh out of school would be
Yeah,
a great
the
time to
best
write an
time.
exam.
There's like 6 months of photos in our photo cloud or whatever, and it's all me sitting at the table studying with all the books, and my kids like hugging me intermittently, being like, when is this gonna end? When do we get our mom back? And when do we get our table back?
I know.
Totally.
Yeah.
I remember
It's hard.
yeah, putting a pot on at night and then like drinking the pot and like putting it in the fridge and then drinking it cold all night long and like and again and again. Like it was awful. It was awful.
It's not nice. And I understand procrastinating it, but I have had a couple of my NDs try to register for it and they haven't been able to register for it. So that's also frustrating because it's big chunks in between too. If they were writing every 4 months, then we could do it, but they're not writing very often.
So if you're listening, make a change, email
Please.
the OND and bring this to someone's attention. One of the other pieces you mentioned in here was the importance of putting your hands on your patient. And that's definitely something that, you know, for you and for us in our training was really heavily emphasized. But I think, I don't know if it's the telemedicine piece or just the, you know, the pandemic, but I feel like people aren't touching their patients and examining them, treating them with their hands the way they should be.
Yeah, it's kind of a lost art, I think, for people. Like, I was shocked when these girls said they hadn't learned fundal height measurements, but it's not their fault. They just haven't learned it. But I think that our ability to connect, this is one of the gifts of naturopathic medicine, is our ability to connect to our patients, right? We don't have to see them in 7 minutes. We don't have a waiting room full of vomiting people. We can connect with our patients. So to connect with them emotionally, connect with them with eye contact, to connect with them knee to knee, great. Listen to patients. Like, if our whole first workshop is like, shut up and listen, because people have a lot of, people just want to be heard, right? I need to be really heard by a practitioner. For many of our patients, the first time anyone's ever sat down and listened to them. So magic in that moment. But when you can then take that and put your hands on them and show them on their body what you're looking at, touch them, it just is that connection, right? There's a quote that's something like, you know, to be heard is as close to being loved as most people can understand, right? Is to just feel that they're connected to you. And it just, I think it's game changing for us to be able to get data, not just from our ears, not just from our Rolodex of brain, but to get data from your hands is important.
I love it. As like an older naturopath who I don't have a ton of hands on, I'm like, now I want to do it. And I'm like, well, where do I go? So I was like, are you available? Are you doing here?
Right. I think it's even in taking Chinese pulses for people is to touch them, but it's to, you know, if people say I have a sore ankle, and instead of just sitting, click, click, click charting, is if you get up out of your chair, which we need to do more often anyway, and like squat down and put your hands on their ankle and like look at it, they have this sort of like, they just feel more heard, and you get data from that. You can see, am I looking at an arthritic joint? Am I looking at a rat? Like, what am I looking at? So it connects us to our patients and there's a lot to be learned. There's a lot to be learned from touching tissues. And so taking courses and learning that stuff, teaching that stuff, reading the fascia, you can see an inflamed body when they walk in and they can't lift their parts, but you can really see an inflamed body when you get your hands on a joint, and it's good data.
Nice.
It's like a lifelong learning approach when you're gathering data in that way on a regular basis. You learn things that other people don't know,
Yeah.
right? And I would say for me, manually, it's not the same as visually. Like through working with kids with autism, it's like you see them do things and you correlate it to their lab work, or you correlate it to, you know, different things that are happening on their skin or their digestive tract. So it's, yeah. And then those clinical ideas, the clinical pearls, or the education that goes like with that is massive for our profession, because we have such a massive amount of information in our profession that people like you who are doing education, like naturopaths who want to learn this need to reach out, right? We need to make sure we're passing this information on to everyone and the next generation.
Yeah, totally. Absolutely.
We'll do another, if you make it, it will come piece.
Right? We'll build another one. Come and learn from us. We'll try to pass some of these pieces of information on to them. And then I think that the teaching piece, I think you kind of touched on it there, Sonia, is that teaching piece back in our philosophy, that docere piece, right? That's a teachable moment, is when I can touch someone's ankle and say, you know, your CRP is 7.6, feel this. And then when they come back in and you can say, look, you're down to 2.3, feel this. It's a teaching opportunity. And it's also a way for us to tie all the bits of their story together for them so that they understand their story. And one of the things when I'm with my students is I will say to them, what I want for you in your patient visit is that I want them to go back to their life, back to their job, back to their family, and tell them, whoever, what happened in that appointment with such passion, because they understand so deeply. You taught them to understand their physiology so deeply that they're so excited. They're so excited about that V. They're so excited about that, like, I got this, I can do this, I just got to get out of my way. And so they're passionate enough about it, and they understand it well enough because you've taught it well enough to them that they can teach other people. And so my staff will joke, you know, if I see someone from Manulife, they'll be like, tick, 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 how long before the Manulife starts to light up the phone when the patient goes back to work? Because that's when you've taught them and they're excited about their health and they're excited about that V. One of the descriptions I use of the V, and we talk about just that healing power of nature, I will say to people, that is the truth in people's soul. If you know, like, that is the truth in people's soul. So I teach in a lot of analogies. So, you know, I'll say to people, if I take a razor blade and I cut the back of this hand slightly, and a little clean cut on the back of this hand, and I'm going to send you home with a tiny bag of salt, and you're going to leave the right hand alone, except to use your first 2 fingers to rub the salt into your left hand twice a day for a week, and come back and see me. And then when you come back, you're going to have a beautiful, clean, healed hand on the right and a hell of a mess on the left. The salt is the gluten. The salt is your lifestyle. The salt is you just need to get out of the way. Your body knows what it's doing. And when you explain to people, all right, like my body knew how to do this, I was just interrupting it. They get that, I call it truth bumps. When people say, oh, that gave me goosebumps. It's like they get it in their soul. Yeah, I know how to do this. I just have to get out of my way. And then they're kind of excited, right? And that's how they, bless you. That's how they spread when they really understood. So we have it set up when I'm teaching. I have my girls at the office. They're kind of my moles, my front end staff. So when one of my new students sees a patient, they'll ask questions when they come out. Hey, what was that? How did that go? And if the patient's like, I don't know. I don't know what I'm taking that for, or I don't know why she gave me that, then they're going back into the teaching room. It's like I want them to understand that. And so when we can integrate the laboratory work, when I can integrate the physical things that I touch, when I can integrate the story, when I can integrate it together, then they get it. Right? That's part of the magic of the teaching.
Well, it's one of the, the core foundational beliefs in naturopathic medicine is that your doctor is teacher, right? And that you transform the lives of your patients, but also their families and their colleagues. And that's how you transform communities, which you're doing in Woodstock, right? We started practicing in Burlington, and then, you see all the Fortinos start carrying the supplements, and then you see Chris is so funny because when my daughter started kindergarten, she's my middle child. And so I went in and met her kindergarten teacher, and she said, oh, are you the naturopath that all the teachers see? I said, no, that's my sister. And it was, she sees tons of the teachers, tons of the police officers, tons of the nurses in this area. And I think that you and some of the naturopaths who've been out in these areas have transformed the health of whole communities, which is really cool, right? As a legacy.
And that's really the goal, right? And you want them to be, that's really the goal, is that you can't see all the people, but if you can get the people helping the people, you heal the community. And then your practice is, and from a practice standpoint, your practice can be smoking busy if you've got those referrals coming in as well, right? It's kind of all part of the community health.
I heard not too long ago, I heard your call. You're like, I'm full. I need help. I heard your call for reinforcements.
Yeah. Throw it out about every 6 months. Please, God, send me an ND prescribing right.
I heard it. And yeah, Woodstock's beautiful. So anyone who's out there,
please, God, come and join me. I honestly have someone so busy. So I have not, right now, luckily, if you called my office and you fit the criteria, you could probably see you by next June, but usually it's at least a year and a half wait for me. And it has been for 18 years. So I've always needed help, and I still give time to patients. I still don't see people in 20 minutes, but I could get someone so busy so quickly. I just can't get a good prescriber in Woodstock. So please.
Yes, if you're listening.
Yeah.
It's interesting because you're talking about the way that you train your new naturopaths and your students. And when I moved out to Halifax, one of your very good friends taught me similar things, right? Where she would take, like a stick figure basically, and then she would put all the symptoms on and say like this headache you're having is related to this, and this is this. And so the person would go home with like their body explained. And so that she was, Dr. Sarah Bailey out in Halifax. It was really great for me as a mentor, as an early naturopathic doctor, to make sure I was doing exactly what you said, like making sure patients know why they're taking things and spread the power of naturopathic medicine.
And then they take your little stick figure drawings. Sarah still does that, by the way.
I love it. That's awesome.
Take your little stick figure drawings. My recycling bin is full of kidneys and like thyroids, glucose regulation, and hormones, and you name it. It's little drawings because that's how people get it.
Sarah just texted me. Your best friend and your best friend just texted me on.
Oh, Sarah Wire.
Sarah Wire. Yeah.
Oh my God, that's funny.
Sarah Wire and I are very good friends, and she bought Pam's practice in Guelph when you moved to Woodstock. So that's who taught me
and
the wiggly bums. Yeah.
Yes, I got her name from Sarah Bailey. See, this is our it's a small world, and we're all still friends.
Yeah,
still friends.
And Sarah Bailey, she was really busy. She still is, and she's transformed Halifax in a similar way to the way that you guys have transformed your cities. And so she sent me a lot of her patients, and so that's actually how I got busy when I was in Halifax. And I was out there with my daughter speaking on autism at the NSAND or whatever, the Naturopathic Association conference, and Sarah Bailey sat next to Ileana, my daughter. And so Sarah Bailey said to Ileana, so what do you want to do? And Illy said, I want to be a naturopath. And she said, you come by my practice. So we'll see, maybe this will go even further, this circle.
Oh, that would be really cool, Sonia. That'd be really cool.
Yeah.
Yeah.
Awesome.
So when I say to Ilya, I'm like, you're going to come practice with me. She's like, well, I still have that offer from Dr. Sarah Bailey out in Halifax. So you'll never know.
She
And
can have
Illy
mine
was
too.
like,
She wants to stay closer.
I was just gonna say, and Illy was like 13, like 12 at the time. So I was like, whoa.
So awesome.
Yeah.
Yeah. So, I mean, I think we could talk to you all day, but one other thing that I really wanted to ask you is how do you balance being such a great mom and such a great naturopath and such a great business owner? Because I think a lot of us struggle with that, and I think it'd be great for other people to hear
Yeah.
how you've managed that.
Well, I don't always manage, son.
Okay, good. It's not just me.
I don't always manage. I come home lots of days in the weeds, but I have really had to work hard at boundaries. I think that's part of why I keep a wait list. I could just jam all those people through, and I just don't. Boundaries have become a really big thing for me. So part of my magic is having really great friends, staff. I always have a team that work with me who I love, who I can put a lot of work onto, or at least, they know me well enough to help me keep my boundaries. I think if you've got people answering your phones or taking calls for you or helping you that don't have boundaries for you, you're screwed. Like, you need good people who can help you out with that. And a family that can help you out with that. But mostly I think just, I have little rules. Like, I try to book a 4-day weekend every 6 weeks in my calendar. I just do it. I don't know what I'm going to do with that 4-day weekend, but when I know that it's there, it allows me to kind of exhale in the busyness of, like, it's okay. I'll do this thing when I have the time to do it. So that's helped guide me. And I think I see clients 3 days a week, and I give myself 1 day for just like homework and research, and 1 day to just do nothing. So if I can keep those boundaries in place, it helps, but it's not easy. It's not easy. And I work in a small community, which means I don't go anywhere without seeing patients, right? So boundaries have had to just become something that I do a lot of therapy about, but also work hard to practice and break them all the time. So
That's a huge life pearl right there. That's huge, I think, for lots of naturopaths. And Chris and I know our front staff have been incredible at keeping us building and successful, but like organized. Because, yeah, I mean, I treat mostly almost entirely children, and so their parents are stressed and overwhelmed, and they can't get enough help. They're not getting help from the traditional system, right? So we could become their everything unless we had sort of like a process to keep them moving forward, but not overwhelming us.
Yeah, totally. And to not get into that relationship where I'm disempowering them, right? Like, when they'll call and I'll say, well, I don't know, what do you think? What do you
It's
think?
awesome.
You knew the answer. You don't need me. Just kind of, so we have little rules, like, I'll answer an email in 24 hours the first time, but if the email again, it's 48, the email again, it's 72. Like, it's just this kind of teaching our patients how to keep our boundaries, but also encouraging them I don't want them to be dependent on me. I want them to find the answers within, or find the answers on their own, not on the internet, but from within, right?
Yeah, teaching our patients as much as we're teaching our students, teaching them to care for themselves and not just depend on someone else. It's beautiful. And it's so important.
Yeah, for sure.
We're the only profession that's trying to work ourselves out of a job.
Right, totally. But so far I'm not winning at that, but it is. Yeah, true.
What are you looking forward to? Like this year, next year? What are you like excited about, or?
That's a good question. I think I have been moving more into a teaching mentoring role, and I wasn't sure what I was going to think of that, but I actually really do like it. So I think I will open the door up more for more teaching and mentoring. I need then an army of people to take these patients who I educate and train, or the students that educate and train. But I really do like that. I really do enjoy that. I'm far enough from the college that I don't very often get preceptor students. I do get them once in a while, but it's a hoof from Toronto. So when I was closer, when I lived in Guelph, I did more of that and liked it. So this has just been a new role to switch into this teaching. I really like it.
It's amazing. Well, the students are lucky to have you for sure. So students, if you're listening, try to get out to Woodstock, right? And it is like the mentorship piece, the culture of mentoring, as Dr. Gignac just mentioned. Like, we need to be talking a lot about how we can help our colleagues and our new grads, because there's a pretty high failure rate, unfortunately, out of the new grads.
There is a high failure rate, and I see with the new grads that sort of mentality of the poverty mentality, that's sort of like, there isn't enough, they don't want to share. And that was one of the things we spent a whole section talking about, referring and like working with your colleagues and referring to your colleagues. For every referral I send out, I think I get 3 back. Like, to be able to kind of build relationships, not just within our profession, but with other professions, so that we can kind of help each other. All of us, we've all kind of got this common goal. Let's work together.
Yep. I love it. I could listen to you for a long time. If you do have a session, then let us know and then we
Yeah.
will help you
Okay.
advertise it because we value the profession. It's one of the reasons we started this, and I'd like to go. I'd like to spot a spot in your weekend or your piece. So
I'd love to have you, Grace.
please, yeah, please keep us updated, and we'll share it with our members. Anything else you want to let like new grads know or younger students to like as a look forward to the future piece? Or
Good question. I mean, I feel like we are the future of medicine. Like I feel like all of us, right? This is like you've done the right thing. You've come here, you're in the right place. This is the future of medicine. If there's any tip, really, I would say keep learning, keep learning, keep learning. Thank you, women, for doing this and offering the education. Keep learning. I mean, the reason I know all you wonderful women is because I see you at conferences, because I see you when I'm learning. We're doing training together. Like, keep learning. Take all the courses. Take way too many courses. Have way too many CE credits. Every single one of them gives you a gem, right? So keep learning, keep going, and like you're in the right place.
awesome. Thank
I love
you.
it. Thank
Yeah.
you so much. Yeah, I say this, all the time, but it's when we started Exceptional ND, it was the idea that we would be in the pursuit of being exceptional, which is a forever journey. So you definitely are a naturopathic doctor who is doing that, and it is an inspiration to lots of people. And for me, as a young naturopath, it definitely was. You were so successful even back then, right? So that we knew that we could have the same level of, hopefully, have the same level of success clinically and
And
professionally.
close. Like she's doing it great, but she's also close, like physically, and
Yeah.
like went to the same school. Like I could do that. So it was good. We appreciated knowing you were around, even if you didn't know we were around. Just it did help
Well,
us
I
knowing
knew.
We've been trouble from the beginning, haven't we, Pam?
Yeah, well, I've thanked God for you guys from the beginning. You're the one that get all my like, I think you guys should see the Doherty sisters, and like just loved what you've had to offer the profession, right? You guys have been in the front line, in the OND, in the teaching from the beginning, and we are so grateful for you women, all of you.
With a squeaky wheel, that's for sure.
We love squeaky wheels.
Yeah. Anyway, thank you. Thank you so much
Thank you so much.
Oh,
for
you're
being
welcome.
you.
Thank you for having me. Thank you very much.
All right. Take care.
Thanks.